There were three problems facing you if you wanted any surgery done in the early 1800s. One of them was the infection that you might get. Another one was the amount of bleeding that you might have to endure. But one of the main terrors was the amount of pain. Many surgeons in the early 1800s used to pride themselves on the speed with which they were able to do surgery to reduce the amount of pain. For example, Robert Liston managed to amputate a leg in 2.5 minutes, but he did it so quickly that he took the patient's testicles off as well. So this was a huge problem. In 1799, Humphrey Davy had discovered that laughing gas reduced some of the pain of surgery, and in 1846 the first experiments with ether were used. Unfortunately, this made patients cough, which is a bit of a problem when you're doing tricky surgery, and also it was flammable, so another solution was needed. Up in Edinburgh, the professor of midwifery at the university there, a man called James Simpson, decided to invite all of his friends round, and they all had little pots of various chemicals which they sniffed to see which was the most effective. And there's a wonderful quote from James Simpson where he said, "I poured some of the chloroform fluid into tumblers in front of my assistants, Dr. Keith and Dr. Duncan and myself, before sitting down to supper, and we inhaled the fluid, and we were all under the table in a minute or two, to my wife's consternation and alarm." So there was now a solution to the pain, chloroform. But this was met by opposition when it was first introduced. First of all, there were concerns about the long-term side effects. Would this affect people's brains or their physical state in the long term? Also, the early surgeons were unsure of doses to use, and when the first person died from the use of chloroform, a lady called Hannah Greener, who died just from when she went into operation to have her toenail removed, this was used for opponents by Simpson to say that this shouldn't be used. And there was an overwhelming feeling as well, especially in the religious climate at the time, that pain was some way sent by God, and it was seen as beneficial to the woman, and helped her bond with her child if she suffered a huge amount of pain during childbirth. But the biggest problem was that surgeons, now they had an unconscious patient in front of them, they began to do lots more complex and intricate operations. And as the problem of infection hadn't been solved yet, this led to greater amounts of infection and also huge amounts of blood loss as well. So after the introduction of chloroform, actually more patients died than before. What was known as the dark days of surgery. But in 1857, Queen Victoria used chloroform when she gave birth to her 8th child, and was quoted of calling chloroform that blessed thing. And once the Queen had spoken openly in support of chloroform, its use became far more widespread, and pain was no longer a problem in surgery.